We're joined in studio today by Michelle Reilly, the Director of Allergan in the Middle East, Europe, Africa. You're the Director of Facial Aesthetics.
Yes, thank you. It's great to be here in South Africa.
So let's first start talking about the different procedures that are on the market today, from chemical peels to laser treatments. What is Allergan's approach to these treatments?
I think at the moment for women, and actually for some men, the amount of processes, procedures is overwhelming. There are so many alternatives to creams now being offered. One of the reasons why I'm here in South Africa is that we're going to launch a new consumer website, a new website for our dermal fillers, to start trying to bust some of those myths around what is a dermal filler and what is a botulinum toxin or Botox. And that's what I'm here today to talk about.
Okay, so what are some of the myths? What's the difference between Botox and fillers?
So the main difference, and this is a good way to think about it, with Botox it's looking at smoothing lines. So it's often used here in the line between your eyebrows, which can sometimes be like a creased piece of paper. And you get, the line starts to become more severe and then sometimes can make you look quite angry. Also then with the laughter lines is a good place to use botulinum toxin, so it will smooth those lines. With a dermal filler gives you the opportunity to revitalise your look or lift certain areas. So dermal fillers are often used in the cheek area when the aging process starts and you start to lose volume. Okay. It also can be used in the eyebrow, in the eye bags, just to give you a less tired look.
Okay, so if you would put it in your eye bags, where would it go, and what would it just lift it up, or?
Yeah, it's really interesting when you start looking at like rejuvenating the eye area, for example. You can look at using a Juvederm dermal filler to lift your eyebrows. But you can also, when you meet with a really good physician who will give you all of this information, there are lots of ways to help your eye bags without injecting anywhere near them. So you can add volume to your cheek area, and that indirectly will help your eye bags. So the big message really is find a really good physician and have this conversation with him about what you want.
Yeah, because there's obviously a lot of dangers or risks involved with getting these procedures done, and if you don't go to the right person, your risks are higher, right?
I mean, there are risks with any procedure, but with Juvederm, we do see that there is minimal swelling and bruising. Most of our physicians report that their patients can go back to work the following day, and that would be our aim. But we completely understand that you often see Juvederm or dermal fillers being advertised in beauty salons, and it's really important to make sure that you are using a qualified medical practitioner. These cannot be done by beauticians or hairdressers or any of the other places that you see these advertised. You can have them done in a beauty salon, but it has to be by a qualified practitioner. And part of the aim for the growing market in South Africa is to give South African women the option of finding a qualified practitioner. So in May, we'll launch our new Juvederm website, and this will give lots of information. South African women ask so many smart questions, so we know we need to start giving you some really good answers.
That's great.
So this website will give you the ability to find a qualified practitioner near you. So you'll know by going to this website, you're going to someone who is qualified to do the treatment.
So how does the South African market differ from international markets?
South Africa is growing so quickly. South African women are asking for much more information about the options aside from surgery. People no longer want to go down the surgical route of having a facelift, but South African women are so beautiful, and this whole beautiful country is very aesthetically driven. So we're seeing much more interest and a growing number of people using Botox and dermal fillers.